Welcome back to The Other Story. Now it's time for the part of our program where we take a look at the possible solutions. Joining us from Karachi is Abid Hassan. From Lahore, Sana Saif joins us. From Quetta, Sayyid Ali Shah. And from our Peshawar bureau, Mumtaz Bangash is with us. Abid, let's begin with you. Describe to us, you've spoken to stakeholders in Karachi. What is the solution?
Well, there are thousands of pharmacies in the city of Karachi, and it is an extremely difficult job for the authorities in order to ensure that no counterfeit medicine is available on their counters. But I did speak to various stakeholders who gave a series of ways in which this menace can actually be curbed. Now, first of all, I made my way down to the FIA director's office. His name is Mir Zubair, and he is over here present in Karachi. Now, what he says is that harsher penalties can actually discourage people from storing these products on their shelves. And more than that, when there's such a harsh penalty on smuggling and dealing in narcotics, maybe a harsher penalty on counterfeit drugs can also discourage people to store them. Now, after this, I made my way down to the pharmaceutical industry representatives who remain skeptical that this menace can actually be curbed to a large extent. They say that although there can be a crackdown on counterfeit medicine, it cannot be eradicated from the market. And they also propose harsher penalties in order to discourage people to do so, apart from a crackdown on the materials that these medicines are made with. From here, I made my way down to the Chief Minister's Advisor's Office, Ms. Sharmila Farooqi. Now, what she wants is an amendment to the Consumer Protection Bill, which she has been advocating for a while. And this would impose harsher penalties and stricter quality control over the products that are stored at our retailers. Now, she has been trying to get this tabled in the Sindh Assembly for a while now, but the resolution is nowhere near. Now, after this, I made my way down to the Pakistan Medical Association's office and met with Dr. Sher Shah and Dr. Tipu Sultan, who have actually given quite a credible way in order to curb this menace. What the doctors over there actually say is that there should be a receipt provided with every medicine that a customer buys. And whenever there's a counterfeit product, it will easily be traced back to its source. And this will definitely discourage people from storing these products on their shelves.
Thank you for that input, Abid. Let's now go over to Sana Saif, who joins us now from Lahore. Sana, you've been part of various raids that have been conducted by the Punjab government. What are stakeholders saying in Punjab? Are these enough or more needs to be done regarding counterfeit medicine?
Well, I have spoken to a number of wholesalers, dealers, chemists, doctors and even consumers. And as far as the raids conducted by the government are concerned, most of them say that they haven't heard or they haven't come across any such action taken by the government in order to control the manufacture and sale of counterfeit medicines. This, they say, is a clear indication towards government's inability in not only controlling this menace but also in making public aware that such an activity is going on in the city. But as far as the solutions proposed by the people are concerned, they say that the key towards controlling this menace, the key towards controlling the manufacture and sale of counterfeit medicines is constant vigilance by the government, constant monitoring by the government, and two, that this action, these penalties that are leveled against the defaulters need to be made public so that they serve as a warning for the defaulters in future.
And now let's cross over to Sayyid Ali Shah in Quetta. What are stakeholders in government departments as well as the pharmaceutical industry saying? What is the solution? How can counterfeit medicine be controlled?
The drug control program should be vigilant and it should launch a crackdown against those selling fake medicines across Balochistan. Similarly, the pharmaceutical companies should closely work with medicine regulator, police and custom officials to stop the sale of counterfeit medicines in the province. The fake medicines, they are being sold in remote areas of Balochistan, and at the same time they are being smuggled into neighboring Afghanistan. The gangs involved in making fake medicines, they have established close contacts with the drug control program, and they are playing with the lives of innocent people in Balochistan.
And now let's cross over to Peshawar, where Mumtaz Bangash joins us now. Mumtaz, it's not only counterfeit medicine. Peshawar has also seen an influx of medicine which are imported from India and China. What are people saying? How can it be avoided?
Well, fake medicines are sold everywhere, not only in Peshawar but all the districts of NWFP. There are some unregistered medical practitioners who are practicing here, and they are the people who are prescribing fake medicine to all those patients who are coming to these clinics. A number of drug inspectors are here, but the problem with them is that they are only few in numbers, and it's not physically possible for them to go to each and every shop and to have check over the fake medicines. and the same is the case with the Health Regulatory Authority, though Health Regulatory Authority is functional here in NWFP, but again they have left the entire job of monitoring and checking the fake medicine to the drug inspector. That's why the government is finding it difficult to stop the business of fake medicines, not only in Peshawar but all the rest of the districts of NWFP. The drug inspectors are trying to seize the fake medicines from all the market, but still the same is being sold in each and every markets of NWFP.
Well, that's it from the other story this week. You took a look at what the problems that are being faced by people across Pakistan due to counterfeit medicine. We also took a look at the possible solutions. Next week at the other story, we take a look at what and how education is being perceived as under threat. Stay tuned to the other story for more. Do write in with your comments, opinion and suggestions. Other story at DawnNews.tv. I'm your host, Osama bin Jaber.